Hey guys, Leigh here. Happy Friday. I thought I would jump on here for a few minutes and give you guys a COVID-19 update for Fayette County. Haven't done that in about a month or so, so I thought maybe you might want to hear what's going on from the health department perspective. Unfortunately, we found out yesterday that we ranked #1 in the state for high occurrence of new cases. The good news is that we did decrease our number. We were at 249 versus 2 weeks ago we were at 299, but we're still at the top, and that's not a top you want to be at. So we need to keep working on that and make sure that we are still wearing our masks, we are still washing our hands, we are still social distancing, we are still keeping small circles, we're doing all the things to protect each other. And then secondly, let's talk about vaccination. So if you were lucky enough to be vaccinated in one of the phase 1A or phase 1B groups that we started this week and last week, you need to keep in mind that you are not fully protected until you receive the second dose and 2 weeks has passed. So just because you got the vaccine doesn't mean that you can go out and do all of the things without the mask, without the hand washing, without all the good stuff. That's not what that means. So just make sure that you understand that it is a process. You do need to wait and understand that you are not fully protected until 2 weeks after that second dose. Thirdly, even if you are vaccinated, I think I sort of mentioned this just a second ago, you still have to wear a mask. So I know everybody's like, oh yeah, I'm free. I don't have to be quarantined. I don't have to wear a mask. I don't have to, I can go visit grandma. No, you cannot. So until we get more vaccine out into more people, the risk of COVID is still very, very high. So we have to keep doing the things, unfortunately, that we don't want to do is wear the mask, wash the hands, social distance. Sound like I'm just beating it into the ground, but that's exactly what it is. And then the last thing I want to talk to you guys about is be kind. We are getting so many calls of harassment and people screaming at us and people emailing us nasty things and people commenting on social media. We're all human. We are all human. And we're having phone troubles sometimes because our call volume is so high, like things that we can't even anticipate are happening, challenges that we are trying to fix quickly and effectively so we can get right back to you. And however, we can't get doing things any faster. The vaccine is coming in very small quantities. The demand for the vaccine is much higher than the supply. So we want to vaccinate you. We can't wait. We cannot wait to get a plethora of vaccine delivered to our door so we can bop out here and get our clinics going, because that's what we want to do and that's what we are trained to do. We want to do it, but we just aren't there yet. And so if you are registered on one of our pre-registrations that you qualify to register, we will call you. We promise. It is time stamped. Your registration follows the order that it was received, and as we open up and get vaccine and schedule more clinics, we will go down that list and we will call you. You do not have to call us every single day. We promise you, we have you, you're on our list, we will call you. Secondly, with that being said, we aren't wasting any vaccine. I know that that's a concern. There really isn't a so-called waste list, as you may have heard in other parts of Ohio. We are just technically going down the line of those that have already registered to see if they're able to pop over and get the vaccine. And then obviously we don't skip you if you can't. You still remain in line, but we will try to find that next person that can come over and get any extra doses that we may have. But I will tell you, our staff is pretty strategic, and we are strategically scheduling appointments pretty quickly and effectively. So we really haven't had that many extra doses to even offer. So just keep that in mind. We're slowly getting in, vaccine each week. We will continue to update our Facebook page, update our website, and I'm just asking you, if you can find it in your heart, to just be a little kinder to, us folks here at the health department, your hospital folks, your other doctor providers or pharmacists who are providing vaccine as well. We are all working as hard as we can, and we cannot wait to get you vaccinated.